Hi everybody, this is a video about Mycoplasma. Someone sent me a few messages and via direct message on a social media platform, and they had some questions about Mycoplasma, so I'm going to do my best to give some useful information around this topic, and I think other folks will be interested in it as well. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I'm just looking through the message thread here. The gist of it is that this individual said that they had a ureaplasma infection. So basically, ureaplasma is a kind of a genitourinary version of mycoplasma. There's mycoplasma pneumonia, and then there's also ureaplasma, which can affect the genitourinary tract, but can also affect the body systemically as well. So the person had this ureaplasma infection in 2020, but then they felt like it came back, even though they didn't test positive, and then some joint pain came along with that as well. They went on antibiotics, they're taking some herbs, and they're just wanting it to not come back again, which is understandable. And then there was sort of a further bit of information about kind of ultimately saying that, so they went on antibiotics and then symptoms got better, but then some antibiotics finished, now symptoms are coming back, so joint pain in various body parts and some nerve pain in the hands. And then ultimately the concern is that they're saying that their healthcare provider is indicating that the ureaplasma / mycoplasma is just a commensal bacteria, so it's kind of supposed to be there, and that it's not actually causing problems and therefore doesn't need to be treated. So understandably, this person is concerned because they're having symptoms, and it's always frustrating to be told that, like, no, the thing you have is not causing problems. I mean, hopefully the healthcare provider is saying, like, there's something going on and we need to get to the bottom of it. Maybe they don't believe it's the ureaplasma, and maybe it's not. But anyways, this is the state of affairs with this message thread. So just a few general bits of information. Again, I can't give any direct treatment advice for this case or anybody's case over social media. However, in my extensive experience, I feel that mycoplasma or ureaplasma are both microbes that can absolutely cause issues for folks, and that's not disputed. It's actually kind of strange in my mind, and maybe there's some miscommunication on some level here, but it's strange in my mind that someone would say, oh, that's a commensal microbe, because, well, mycoplasma or ureaplasma can be fairly common. Like, to my understanding, they're not commensal microbes. They're not supposed to be there in the body. So maybe what's being lost in translation a little bit, or what maybe was miscommunicated to the person asking the question, is that, well, if there's testing showing that there's positive antibodies, maybe it's just they're lingering because there was that past exposure or something like that. I'm not sure. What I can say is that I've seen good treatment results using herbal interventions to treat mycoplasma or ureaplasma. The challenge, and the individual asking the question was talking about how they're taking, I think, cordyceps and cat's claw and Chinese skullcap and isatis, and especially the Chinese skullcap and isatis are herbs that are generally considered to be fairly targeted for mycoplasma. In my opinion, other herbs like cryptolepis or alcornia or Sida acuta are also herbs to consider when treating mycoplasma. But the question in my mind, when I have a patient who's dealing with a mycoplasma-related issue, is where is the mycoplasma kind of hunkered down? If I put a patient on systemic antimicrobials, their symptoms get systematically better until they're 100%, then great. It's not hunkered down anywhere. It's probably not hiding in biofilms. It's just out in the open. We killed it off. But if patients are having symptoms coming back, it either means that we didn't fully saturate the body with enough antimicrobial treatment, whether it's antibiotics or herbs or a combination of both, to actually get rid of all the microbes. So the level of microbes was squashed down a lot, but not enough. And so then, we're getting squashed down with treatment. Oh no, oh no, oh no. This is mycoplasma talking, saying, oh no. But then treatment stops because, symptoms are improved enough, or the antibiotic course has run out or whatnot. And then, no more antibiotics, no more herbs. Okay, let's start regrowing again. And then symptoms start blooming. So one possibility with when there are relapsing symptoms is that the treatment wasn't done didn't go on for long enough, or another possibility is that there might be biofilms, and especially if issues originate in the bladder, then that can be a notable obstacle, because we need to make sure that we're working with a high enough concentration of herbs that are actually going to be flushed out through the bladder and treating mycoplasma to be living in the bladder, but also working with biofilm disruptors to actually break down the biofilms that may be in the bladder as well. There are some advanced laboratory tests that can be done to look not for biofilms specifically, to my understanding, but can look for a wider array of microbes that might still be kicking around in the bladder. And so especially if somebody went on some herbs and some biofilm disruptors, kind of a provocation profile, and then sent in a urine sample for a culture that can kind of disrupt the biofilms, kind of rustle the bushes, get the microbes out into the open, and then have a better chance of picking up a microbe that might still be lingering. So those would be the two main things that I'd be thinking of if I was working with a patient like this in my practice, thinking, well, have the microbes been saturated enough or has the body been saturated enough to kill the microbes off thoroughly, or are there maybe some biofilms that are hunkered down somewhere? There's always the possibility too there might be something else going on. It's like, oh, I went on antibiotic, like I know I have this Mycoplasma infection, I went on antibiotics, I feel better, my prescription ran out, I'm feeling worse. It stands to reason that we'd be thinking, oh, it must be Mycoplasma coming back. It's also possible though that the antibiotics that were used were killing something else. Maybe they were killing Borrelia, maybe they were killing Bartonella, maybe something else. So that's something that I would keep in the back of my mind as a clinician as well, depending on how things were going if we were targeting the suspected Mycoplasma. So I hope that this information was of interest to folks listening. If anybody has any questions on this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.